In the course of setting up Donolush Healthcare Solutions, we've had other smaller clinics. We have a dental clinic, we have an eye clinic under one roof that we run. Because I will refer back to when I was a general manager in the HMO. I got to, from data, I got to find out that the demand for eye and dental care was rising. And I said, and I was getting complaints then from the enrollees. And I said, okay, when I leave my current paid employment and I set up my own, I want to do something that there will be patient satisfaction. And that's one of the reasons. 2017, that was when we started with the eye and the dental clinic. And I tell you, so far so good. The feedback has been very good. And for the Donolush, we do a lot of consulting. We are having some PPPs, public-private partnership with state governments. And we're into a lot of supplies of medical equipment and distribution of medical consumables. And these are a little contribution to the health sector. As regards the leadership of the country, in terms of retaining the manpower, there should be sincerity of purpose. Because you find out that if the condition of service is okay here, it's not just the remuneration. The remuneration is bad for doctors and other health workers. But you find out that the workload, the standard, when you're talking of patient-doctor ratio, the WHO standard is 1 to 600. But trust me, a GP in Lagos State General Hospital, the ratio is between 1 and almost 5,000. So the workload is killing. And also the infrastructures are not available. So if all these things can be put in place, because as a doctor you are trained to save life, in a situation where you are losing life because the devices you are supposed to use to save life are not available, you don't feel bad, you feel bad. And so those are part of the reasons with the poor remuneration. That's why we have this human capital flight. And if the government can address all these issues, even the doctors in the diaspora, they will come up.